Good afternoon, good afternoon, everybody. Firstly, I would like to thank Dr. Moinuddin Khan sir and Dr. Prahlad sir for giving me this opportunity to come and speak here. I know it is pretty late and uh, people are already tired, but I won't take more than 10 minutes to finish my presentation. It's a very interesting topic. It is about the use of navigation in endoscopic sinus surgery. This is just an introduction to the use of navigation in FESS. So let me give you a situation. You have to go somewhere. You have decided to go, but you don't know the route. You're a beginner. You know the driving, but you don't know the route. What will you do? Will you ask someone, or will you switch on the navigation and drive yourself? Let's move on to a second situation. You know the regular route, but on that day, due to some natural calamity, the road is blocked and you cannot take your regular route. So what will you do? Will you take an alternate route, or will you log on to navigation and drive by yourself? In the third situation, you know the regular route, but you want to reach the destination early on that particular day, and you find there's a huge traffic jam. Now what will you do? Wait till the traffic jam clears, or will you put on the navigation and drive by yourself? So what is common in all the three situations is that you know car driving, you know the regular route, and you're still using navigation for reaching your particular destination with ease. So if we are using navigation in all these situations, why not use navigation during your surgery also? Navigation is never a substitute for knowledge and skill. It is not a magical tool which can overcome all these things. It is only helping you clear the disease better and help you during the surgery to achieve better results. So moving on to navigation in ENT. So what exactly is navigation? Navigation is one technology which converts three-dimensional points on a patient's anatomy onto a two-dimensional scan, which we are all used to reading. So if we point out on the tip of the nose, on the CT scan, on all the different views, the tip of the nose is pointed. This is very helpful during surgery. How does this navigation work? So basically, as a first step, we have to acquire the CT scans of the patient. There is a particular protocol for acquiring CT scans. We have to take high definition, high resolution cuts of the patient in axial view. So normally 1 millimeter cuts are what are ideal in the axial view with a gantry tilt of 0 degrees. These images are stored on a CD or a pen drive. This is uploaded onto the navigation system. The navigation system then converts the axial scans and creates a three-dimensional image and helps us correlate one particular anatomy of the patient's body onto the scans. Suppose we are pointing on to the nasion, then on the navigation on all the three sections, the cursor will be pointing on to the nasion. So why exactly should we use image-guided surgery? First and foremost, sinus anatomy is not constant. Every patient, there is some anatomical variation. So this is where it will help. And second thing, the disease itself would have distorted the normal anatomy. Or a surgical procedure, previous surgical procedure would have obscured the normal anatomy, and these are the cases where it is more helpful. And as you all know, critical anatomical structures are just millimeters away from the place where we are operating. This is where it really helps. In this picture, you can see that the disease, the fungal disease has actually eroding into the anterior cranial fossa. Studies have shown that by the use of image-guided surgery, the complications in ENT surgery, especially the major complications, have reduced by 70% and minor complications by 50%. Guidelines by the American Association of Otorhinolaryngologists and Head Neck Surgeons were laid down in 2002. And according to them, this is when you're supposed to use image-guided surgery, especially in case of revision surgery, sinus surgeries, in patients with distorted anatomy, in extensive nasal polyposis, where the normal anatomical landmarks are obscure, the pathology involving the frontal, posterior ethmoids or sphenoids. According to them, only diseases in the maxillary sinus and the anterior ethmoidal sinus, you need not use navigation. For all the other cases, navigation can be used. And disease abutting the cranial base, optic nerve, orbit, or the carotids, in cases where in cases with CSF rhinorrhea, where skull-based defects need to be addressed, and benign and malignant neoplasms of the paranasal sinuses. So in this example, in a typical navigation profile, you can see all the four views. That is the view in the coronal section, the sagittal, axial section, and also the endoscopic view. In here, you can see the instrument is actually in the frontal rhesus area, and on the coronal and the sagittal cuts, you can very clearly see that where the tip of the instrument is pointing. Here, we are actually using a straight navigation suction. This is actually sucking the polyp in the middle Myiasis area, and again you can correlate the anatomy on the coronal and the sagittal cuts. Now the instrument is actually inside the maxillary sinus. Now you can know the relationship between the orbit as well as the orbital wall and the maxillary sinus. Now the instrument is actually in the frontal sinus area. We have crossed the frontal beak and entered into the frontal sinus, and we can very clearly see it on the coronal and the sagittal cuts. The instrument is just anterior to the sphenoid. We can see on the endoscopic view that the instrument is